And then you're going to get two separate options. So you're going to have the DVT-PE option and then the ACS option. So we'll just choose the ACS. Most patients are always going to have a bolus, but some patients, if they don't want the bolus given, but most of the time they are. The difference between these two is that the starting rate is always going to be 12 or 14 units, depending on what order set you're using. Your bolus will still always be your weight-based with a max dose of 4,000 units. So if you have somebody who is a little bit larger, then you still are only going to give 4,000 units for the push. I'm not going to sign these orders since this is real, but once you have this in here, it's going to give you your starting rate at the 14 or 12 units per kg per hour. And then once you type that in, it's going to give you your rate on that. The biggest thing with heparin is make sure that you have a PTT pending, but you do not have to wait for that to be resulted to start it. And then as soon as you start your infusion, you want to put in the orders for the 6-hour PTT. So that's really important. That's probably the area that gets missed the most in trying to repeat those. So every time that you make a dose change or are just doing your 6-hour check, then you need to put in another 6 hours from there. So when there are errors, typically that's what's caught. There's been times where it might go 24 hours and nobody's redrawn a PTT. So if you are transferring somebody out that is actively, let's say somebody they have a heart attack and you're getting them out immediately, the most important piece of this is to do the bolus. If you have everything else ready to go and the patient's ready to leave, don't start the infusion. It's going to get stopped as soon as they get to the cath lab. So most important part is just the bolus. If you have time, absolutely start the infusion. It's going to be a dual cosign. So what I recommend is as soon as you have everything ready, if you're the primary nurse, get everything pulled up and primed on your pump to make sure that you have done your first check. When you ask somebody to come in, have them do a dual sign off. So it should be independent, not just come in, yep, I know Mandy's a really good nurse, so I'm going to just type it in. They should be acting like they're setting it up for the first time as well, so that if there's any discrepancies, that's getting caught. Once, so you are going to have to co-sign your bolus as well as obviously the continuous infusion. Once that is done, the other thing I always recommend, if you're that secondary nurse, to come in and check is just, hey, did you put in that 6-hour PTT? Just as that final reminder. The order set's awesome for everything else but that, because it can change so much. What questions do you guys have on that? Nothing? Okay. The pump itself, the biggest thing on that is just to make sure that you've got your weight in there. Your rate might be just a little bit off from the pump to what you have in Epic, but that's okay as long as it's...
If there's two PTTs in normal range, then does it go every 24 hours?
So in the order set, there is a link to the reference guide. Once you click into that, it's going to give you everything that you need to start the infusion. And then at the bottom, when you're ready to do your rate change, once you've had your first PTT resulted, and you always want to do that 6-hour one. So who cares about what that first one was? It really is just your baseline to things. So don't ever make an adjustment on that first one. That second one, depending on what that result is, it's going to tell you in that table if you need to increase it, decrease it, keep it the same. Really, as far as the discontinuation goes, that's going to be up to the provider. You're never going to discontinue heparin based on the template of that. Okay.
But I do think you are correct. It does say in the order set if 2 PTTs are within therapeutic range, then to go to every 24. But I'd probably still check with the...
I thought you meant to discontinue.
No, he was talking about the
I'm sorry. Yes, I'm sorry. I thought you meant discontinue the heparin. Yeah. Okay.